Hi, my name is Celine Chalfant, and this is my informative speech. How many of you know someone who's been diagnosed with diabetes? Look around you. Did you know 1 out of every 5 people have diabetes? According to diabetesresearch.org, in 2018, 34.2 million Americans, or 10.5% of the population, have diabetes. After many years of research and learning what diabetes is, I experienced my father being diagnosed with diabetes, and I watched him maintain a controlled diet as well as exercise regularly to control his blood sugar levels. Today, I'm going to discuss what is diabetes, as well as the 3 main types and the symptoms, diagnosis, and treatments. So, what is diabetes? According to diabetes.org, diabetes is a serious health condition that causes higher than normal blood sugar levels. Diabetes occurs when the body can't make or effectively use its own insulin, hormone made by special cells in the pancreas called islets. Insulin serves as a key to open your cells to allow the sugar, also known as glucose, from the food you eat to enter. Then the body uses that glucose for energy. When too much blood sugar is in the bloodstream, it's because there isn't enough insulin or the body cells stop responding to it, which can cause serious health conditions such as kidney disease, heart disease, and even vision loss. Now that I have explained what diabetes is, I will discuss what the 3 main types of diabetes are. Type 1 is also known as juvenile diabetes, and it's when the pancreas produces little to no insulin, which results in high blood sugar levels in the body. Patients who have type 1 diabetes must treat these diabetes by taking insulin injections. Type 2 diabetes, also formerly known as adult onset diabetes, occurs because high blood sugars, lack of insulin, and insulin resistance, which means the body is not producing enough insulin to pump to the cells. According to CDC.gov, 90 to 95% of people who have diabetes have type 2 diabetes. Patients with type 2 diabetes must treat them with a monitored and charted diet as well as staying active. Type 2 diabetes usually occur in adults, but has now become more common in children and teens because of the lack of healthy eating, the lack of exercise, as well as weight gain. Many adults who experience prediabetes before reaching type 2 diabetes is because the blood sugar levels are higher than normal, but not high enough to be diagnosed as type 2 diabetes. Lastly, gestational diabetes. Gestational diabetes is diabetes that occur in a woman's pregnancy towards the middle or the late. If a woman is diagnosed with gestational diabetes, it is crucial to get them under control and treated to protect the unborn baby's growth and development. Gestational diabetes is more of a risk for the baby than the mother because the mother's blood sugar travels through the placenta to the baby, which can result in the baby being overly large at delivery or becoming diabetic later in life. According to Stephanie Watson on Healthline.com, she states gestational diabetes should go away after you deliver, but it does significantly increase the risk of becoming diabetic later in life. Now that I've explained the main 3 types of diabetes, I will now discuss the symptoms, the diagnosis, and the treatments. There's many different symptoms for each type. Symptoms include irritability, weight gain, frequent urination, feeling dehydrated, feeling hungry, high blood sugar. If you experience any of these symptoms, please seek help from a doctor. Doctors mainly diagnose diabetes through urine tests, which helps decipher the excess amount of glucose. Doctors also use blood tests to assess the blood sugar levels. The higher the glucose level, the more likely you are to be diagnosed with diabetes. There's 3 different types of diabetes, some with the same symptoms, some with different treatments. Nazario on WebMD.com states you may also need other healthcare professionals on diabetes treatment team, including foot doctor, nutritionist, eye doctor, and diabetes specialists, also known as endocrinologists. Now that I've stated the diabetes symptoms, treatments, and diagnosis, I will now leave you off with one more thing. Don't wait too long to seek help. If you are feeling any of these symptoms, please get help from a doctor. I understand that being diagnosed with diabetes can be a stressful or hard time, and you may cope in any way comfortable that you feel doing so.